It all began quietly in late December 2019. Doctors in Wuhan, China, noticed patients with a strange pneumonia-like illness. The symptoms looked like the flu, but were more severe. Some patients developed dangerous breathing problems. On December 31, 2019, China alerted the World Health Organization that a cluster of unknown cases had emerged. Most were linked to a seafood market. Few outside China paid attention, but within weeks, this mystery illness would change the entire world. By January 2020, the disease spread beyond China's borders. Cases appeared in Thailand, Japan, South Korea, and the United States. On January 11, 2020, the first death was reported in Wuhan. Days later, the Chinese city of 11 million people was placed under strict lockdown. Streets emptied, flights were canceled, and checkpoints sealed off entire neighborhoods. But the virus had already slipped through. On January 30, 2020, the World Health Organization declared a public health emergency of international concern. Within 2 months, COVID-19 was detected on every continent except Antarctica. In March 2020, Europe became the new epicenter. Italy's hospitals were overwhelmed, and the government ordered a nationwide lockdown. Soon, France, Spain, the United Kingdom, and the United States followed. Schools and offices shut down. Major cities like New York, Paris, London, and Delhi fell silent. Airplanes sat grounded on empty runways. The Tokyo 2020 Olympics were postponed for the first time in history. Life as people knew it stopped. The lockdowns triggered the sharpest economic downturn since the Great Depression. Stock markets crashed in March 2020. Millions lost their jobs overnight as businesses closed. Supply chains broke down, leaving supermarkets short of essentials and factories unable to operate. Governments scrambled to respond. The U.S. launched a $2 trillion stimulus package. European countries created wage support programs. But uncertainty remained. When would it end? COVID-19 was not just an economic crisis. It was a human tragedy. Hospitals filled beyond capacity. In Italy, doctors were forced to choose which patients would get ventilators. In New York, makeshift morgues were set up outside hospitals. Families said goodbye to loved ones through video calls. Frontline healthcare workers, doctors, nurses, paramedics, became heroes. Many worked in hazmat suits for hours, isolated from their families, risking infection. Some never returned home. By the end of 2020, 1.8 million people had died. As the death toll mounted, the world's scientists launched a race against time. Pharmaceutical companies like Pfizer, Moderna, AstraZeneca, and Johnson & Johnson began developing vaccines in record speed. Normally, this process takes years, even decades. But within 11 months, the first vaccine doses were authorized for emergency use. In December 2020, a British grandmother, Margaret Keenan, became the first person in the world to receive a COVID-19 vaccine outside of clinical trials. Hope had arrived, yet distribution was unequal. Wealthy nations secured millions of doses, while poorer countries waited months, even years. For ordinary people, daily life completely changed. Work from home became the norm. Zoom calls replaced meetings. Parents balanced jobs with homeschooling. Masks, hand sanitizer, and temperature checks became part of everyday life. Isolation fueled mental health struggles. At the same time, people found creative outlets. From balcony concerts in Italy to viral TikTok dances, the world tried to stay connected, but the fight was far from over. By mid-2021, new variants of the virus, Alpha, Delta, Omicron, spread across the world. Some were more infectious, others partially resistant to vaccines. Nations that had relaxed restrictions reimposed them. International travel faced new bans. The pandemic entered its second, then third year, with wave after wave of infections. COVID-19 changed the world in ways still being measured. It revealed weaknesses in global healthcare systems. It accelerated remote work, online learning, and digital life. It deepened inequalities between rich and poor nations. And it reshaped travel with border controls, vaccine passports, and a new awareness of global health security. By 2023, the WHO declared the global emergency over. Yet millions still live with the physical and emotional scars. COVID-19 was not just a health crisis. It was a test of humanity's resilience. It showed how fragile life can be, but also how people adapt, unite, and fight back. From scientists racing to develop vaccines, to ordinary people showing kindness in dark times, the pandemic became one of the most defining moments of our century. The world may never return to exactly what it was, but history will remember how we endured and what we learned. If you want to understand more pivotal moments in history, subscribe and join us for the next story that shaped our world.